Spiritual nursing care interventions for end-of-life care during the COVID-19 pandemic. Understanding the concept of compassion, we'll now present a short reflection on the simulation you would have just watched. So let's take some time to reflect on the scenes we saw in our first simulation. The first showed Mary, our patient, being admitted by a nurse. The first clip we saw the nurse racing down the corridor, and we saw that her facial expressions weren't very open. She arrived at the bedside and roughly placed the patient notes on the bed table and proceeded to begin her admission without even introducing herself. So I suppose the key question here is, well, do we think the nurse demonstrated a compassionate response to Mary's suffering? Mary has come in for treatment of a newly diagnosed cancer. Obviously, she's scared and worried about herself, but she also has concerns for her son, particularly when the nurse very abruptly speaks of her diagnosis. And the concern then expressed by the son, which is completely pushed aside and brushed aside, focusing more on attention to behavior, despite the fact that the son's response is quite a natural behavioral response to concerns about a diagnosis of their mother. What we saw was a nurse who was obviously anxious to get things done before they were going off duty, but just because one's work shift is ending soon doesn't provide the permission to not be kind and caring and to show compassion in how we interact with the patient and their family. Let's now consider how Adam interacted with Mary and her son. Did you see compassion in action here? Think about it. We saw Adam taking a seat, meeting his patient at eye level, creating that space where a conversation can happen, introducing himself, asking Mary what is it she likes to be called, how does she like to be known, making sure that he was almost given permission to use her name. He was then introduced to her son, and he asked her why she was here, why was she being admitted, in a very caring, considered way, asking a question in order to understand the level of information and understanding that Mary had about her diagnosis. Yes, both interactions of the nurses are quite different in how they are presented. And they're done so in a stark way to show how easy it is for us to fall out of the desired space of compassion, where we see the suffering of the other person and attempt to respond to it. And that's what we do every time we interact with patients in our care. But more importantly, it's something that we have seen more and more needed over the last 2.5 years with COVID, particularly when people in our care have been dying in our care, and because of restrictions, their families have not been close to them to provide that additional support that they may need. This is why this concept called compassion, this recognition of the suffering of the other person and our response to it, is so important.
Hello, my name is Shauna Sweeney and I'm a lead healthcare chaplain working in a hospice in Ireland. Before I reflect on the simulation video that portrays the patient Mary being admitted to hospital, it is important that we know what compassion is. We all show compassion to people around us daily and probably are unaware of doing so. Compassion is when we are empathic to someone else's pain or suffering and want to help or support them in it. Knowing that you may not be able to change what they are going through, but you want to help in any way to ease their burden. It's something that we do naturally all the time but are unaware. You have had a reaction to this video, probably like myself, so I'm going to delve into it and see how the interventions went horribly wrong in some cases and on the flip side then showed really good best practice nursing care. So let's delve right in. When the nurse bangs the chart on the table, we can already start to see how this admission is going to go. She startles the patient from the outset. It was not an adequate or professional introduction to the patient Mary, and the nurse does not tell the patient her name. The nurse does not have open non-verbal body language and is cold and standoffish and does not maintain eye contact with Mary. The nurse appears impatient and uninterested, and she did not let the patient introduce herself or allow to open a meaningful engagement with her. When she said, "I'm obviously the nurse," it created a confrontational atmosphere. The nurse should not have assumed that the person with the patient was her next of kin. The nurse does not notice that Mary appears uncomfortable with John in the room and continues to discuss Mary's medical diagnosis. We can see how upsetting and shocking this is for John to hear. The nurse's interaction has caused great stress to Mary and John on top of an already distressing and anxious time. The nurse lacked compassion, empathy and understanding towards John and continued to impose her frank and unprofessional manner towards Mary and John. We visibly see how amplified Mary and John's distress becomes. And although our priority is always for our patients that we care for, it is imperative to be considerate and compassionate to their loved ones who are journeying alongside these patients. The patient was not comforted or reassured about the next steps of her hospital stay, and we see how the nurse puts her own needs first without consideration of what Mary, the patient, might be feeling at such an uncertain, scary and stressful time. So much so, the patient was in tears by the time the nurse left after a 2-minute exchange. We could see how her distress and worry manifested when Mary shouts for John, wanting to console him after hearing about her diagnosis. When we see the next clip, the nurse Adam has a gentle, patient-centred approach. His initial interaction with Mary displays warmth, and he introduces himself and asks the patient Mary for her information and says hello to John. He explores what Mary is there for and gives her the autonomy to disclose what she wishes. You can see how Mary takes control of the information she shares whilst John is with her. Adam has created a warm, inviting environment where Mary appears to be in control. Adam has the awareness to see that Mary appeared distressed and asked her an open-ended question with concern. Throughout Mary's admission, the nurse, Adam, maintained eye contact with Mary and displayed appropriate non-verbal communication. When Adam involves Mary in the care plan for herself and John, reassuring her that he will organise counselling and will liaise with Mary, we can already see how much this means to Mary. This has been a positive and reassuring admission for her, and it demonstrates Adam's professionalism and compassionate interaction with her as we can see her anxiety is eased, and even with John. Like Adam, you have decided to become a nurse because you have a desire to help ease the suffering of people you will care for. You have a desire to do good and be supportive to others. You as nurses care for the patients from your heart. When the nurse Adam showed care and compassion to Mary, we could visibly see Mary relax as she knew she could be taken care of, but most importantly that she would be listened to. As healthcare professionals, we care for many patients each day, and it can be busy with lots of demands, but we need to remember that this may be the patient's first experience of being in hospital. They could be frightened about their diagnosis, they may be in pain, they could be worried about their future, and could have anxiety around dying. And if we could ease a small part of that pain and anxiety by being compassionate and caring for them holistically, then we are not just bringing meaning to their lives, but also to our own. The author, Mark Twain, puts it beautifully in that kindness is the language which the deaf can hear and the blind can see. Kindness and compassion is the universal language that is understood beyond the limitations. Thank you.